Welcome, everybody. We appreciate you joining us tonight. We're going to give it just a couple minutes, let people jump on. Welcome, welcome, welcome. I love seeing some of these familiar names in the participant list. So happy you could join us tonight. Thank you for being here. We'll give it just a minute more. We have 40 people signed up tonight. And see who can join us. I know the name is not fun. So welcome, everybody. We do have Spanish interpretation available. I think everybody knows how to access it now. We are recording this, so I will also be sending out the recording tomorrow. And I know our speaker has a PowerPoint, so we can share that as well. But we're going to go ahead and get started. I know we'll have more people join us, but I want to respect everybody's time. Excited to have everybody here tonight and to hear our special guest presenter, Rosie Martinez. I had the opportunity to meet her a couple months ago. Did not even know about this new position that she has. She's the Inland Regional Center's new System of Care Coordinator. And I've referred a few families to her. She's been fabulous. So I can't wait to see the presentation that she has for us tonight. As always, if you have questions, please throw them in the chat, the Q&A. I know after Rosie's presentation, we will be taking Q&A. Of course, it can't be about your specific case. You have to talk about something generally if you have a question about resources, because she's not going to be able to comment specifically on your case at this time. So one more big thank you to Gilbert, who is our interpreter. And with that, I am going to go dark and turn it over to Rosie and hear about all the good work she's doing.
Hi, everyone. Thank you for joining me today. I'm going to try to get this PowerPoint up. Like Beth introduced me already, my title is Systems of Care Coordinator. It is a new position with the Inland Regional Center. There. My name is Rosalba Martinez. I do go by Rosie, and I work under the Children and Transition Services at IRC. Our agenda today, we're going to cover an introduction regarding my title, Systems of Care Coordinator. We'll go over the System of Care Partners, and then we'll also discuss complex needs and a couple of resources, both internal at IRC and then outside collaboration. My position, the System of Care Coordinator position, was created as a result of AB 2083. That is the law that was passed in 2018. The key points of the bill were to allow interagency collaboration, a timely delivery of service, and for families and consumers to explore more resources. The System of Care Partners. My position is a collaboration position, so I work with all of these agencies on here. As you can see, the child and family are in the center because our main focus is always them. And then we work with all the regional centers in California. We can collaborate with each other. We also work with the probation departments, the Department of Children and Family Services, formerly referred to as CPS, Child Protective Services, the Department of Behavioral and Mental Health, the Department of Rehabilitation, and the school district. So when we have an individual who has involvement with multiple agencies, whether it's probation or maybe they just have a dual diagnosis of mental health, then we do collaborate with everyone to make sure that we're all providing the most services that they need. And it's a collaborative effort. Internal collaborations. IRC has multiple units, and each of them have their specialties. One of the internal resources right now is my position, of care position. When we have cases that have complex needs, the service coordinators are able to come to me and discuss the cases, and I usually collaborate with them regarding the needs that they might have. There might be resources out there that the service coordinator is not aware of. So I give them the information and they take it back to the families and see if it's an option for them, something that they might want to look into. We also have the behavioral health teams. This is one of the teams that was mainly used for like ABA services. So you might be familiar with this team if you've had to have ABA services in the past. Right now, our behavioral health team, if your insurance does not cover ABA services, your service coordinator can still request ABA from the behavioral health team. They're also a great team to go to discuss trainings that might be appropriate for your son or daughter. They also are able to discuss crisis services. And crisis services is one of our most popular service at this time for individuals with severe behaviors, because they are the ones that will provide like a full wraparound team. So if you're not aware about this service, this is one of the ones where if you needed more information, I would highly encourage you to speak to your service coordinator about and discuss that process. A clinical review. Our clinical review team is used to discuss the following services. And you can, service coordinators can request meetings with our clinical review team to discuss services like dental services, dietitian, neurology, nurse consultation, pharmacology, which is the term we use for like the pharmacy, the medication reviews, psychiatry, and genetics. So if there's ever a concern regarding any of those topics, and you've already reached out to the insurance and you're not able to get the support you need, reach out to your service coordinator and she can request a meeting with the clinical team to get more information for you. IDT meetings and IPP meetings, of course, that's the best way to get the services that you need. So when it's an IDT meeting, and it's a great way to have the family involved, the service coordinator, the program manager can be in those meetings as well. And you guys can discuss services or concerns that you might have. It is a documented meeting, so everything will, stay on record. The IPP, you're always going to want to have the services that you're requesting in your IPP. So if there's ever something that comes up that you've heard, the service might be available, you will ask your service coordinator about it, see if it's an appropriate service. And then during your IPP meetings, mention it. So it's definitely in the IPP and it's a service that can be offered to you if, of course, you qualify for the service, your son or daughter. The joint mental health meetings, these are monthly meetings that IRC does with multiple agencies, actually. It's mental health, probation, school districts. A lot of the system care partners that were in the previous slides attend these meetings. And it's also a collaborative effort where we meet, discuss the case, and then everybody just kind of provides input on how to best support the case. These are regional center meetings, so we don't invite the family, we don't invite the consumer, son or daughter. But if you would like your service coordinator to get input from these other agencies, you can also request your service coordinator to attend one of these meetings and present the case. So this is probably the best way to get a collaborative effort from all these other entities involved. Outside resources. So these are just agencies that work with us. It's also a lot of the system of care partners, but I'll break it down exactly how we work with them. So the Department of Behavioral Mental Health, and I say behavioral mental health because San Bernardino refers to it as behavioral health, and then Riverside refers to it as mental health. I am providing you with the numbers, the San Bernardino Access Unit and the Riverside Health Systems information. These are the two departments that you can call when you have a concern regarding a mental health need. Sometimes the severe behaviors could be a result of a mental health need, and these two departments would be able to assess the need and then get you in contact with the appropriate services. Another option when it comes to behavior and mental health, we do have a liaison, a Department of Behavioral Health liaison. So when you have specific questions or you try to reach these numbers and you weren't able to get the support you need, you can reach out to your service coordinator. She can reach out, they can reach out to me, or you can reach out to me yourself, and I will try to put you in contact with that liaison so you have that direct connection as well. The insurance, same thing. We also have liaisons for IEHP and Molina. So when we have a situation where the family feels like they're not getting the support they need, or we're not getting a fast enough response, and we have a question regarding the service or a referral that might have been pending for months, and it's causing a delay in the service, we can also reach out to them and try to get an update for you, or invite them to meetings. We've also invited these liaisons to meetings, like team meetings, to discuss a case. That's an option that we have as well. The schools, when you have your IEPs, I always encourage families to invite service coordinators to IEPs because they can also be a voice for you. So whenever there's an IEP, always let the school know. If you can please invite my service coordinator. You know, they have the information regarding my child, son or daughter, and the services and supports that they need. But if you ever find yourself not getting the support that you need from your IEPs, we also have advocacy services. So that's something that could be requested. And if that doesn't work out for you as well, we could also have meetings. Like I said, we work with the school districts as well. So we do reach out to them for support, and we do collaborate with them as well. CFT meetings. So these are children and family team meetings, and these are specific to children in foster care. So when there are situations that a CPS worker is involved, a CFS worker is involved, you are entitled to have CFT meetings. And as a family, as the parents, or foster parents, if you're a foster parent, you can invite whoever you want to these meetings. You know, anybody you feel is a support to you can be invited to these meetings, and you are entitled to request these meetings. They should be having these meetings to keep you updated with what's going on in the case. So if you are in this situation and you haven't heard from anybody, you feel like you're not getting the information you need, feel free to ask for CFT meetings. You can also ask your service coordinator for more information, since I do have a flyer for parents that's specific for CFT meetings. And again, this is for foster care children or those who have like a CFS case open where there's a CFS worker involved. The free trainings and Catalyst Center, I put this on there just as a resource for parents who might want to have training. They're free trainings. They have a training right now that's specific to crisis intervention. So they go over the topic of crisis intervention and how to work with severe behaviors. And like I mentioned, it's a free training. So I encourage parents who might be in this position where they're having a son or daughter experiencing severe behaviors and they don't know how to do crisis intervention. Crisis intervention is the service that our residential facilities, it's the techniques that they use when dealing with the behavior in a residential facility. So this is a free training for parents to learn more information about that and how to implement it themselves if they need to use it. I'll go ahead and try to open it. So just so I can show you quickly how to get to those trainings. This is the page I will open up. It's their home page. But once you go to the courses offered, this is the trainings that they have available. They have a lot of trauma responsive caregiving.
Rosie, we can't see we still see your presentation. We don't see the website.
Oh, okay. Let me close that. How about now?
Nope, still see the presentation.
Let's close the presentation then. Okay, how about now?
There we go.
Okay,
Yep, so go
yes,
all the way up. Yeah, so we can see it. Yep, thank you.
okay, good, thank you. This is the website where the trainings are located. A lot of it is trauma responsive caregiving. I take these trainings, I think they're very informative, but the one that I was mentioning regarding crisis intervention is right here, crisis intervention and de-escalation. So if parents are interested in this free training, you can register for the course. The information is there. They'll send you a little calendar invite. This is almost 4 hours long, but it is a free course. And I think you would benefit from it if you are having working with your child or daughter who has severe behaviors. This might be one of those best options to do, just to get some more information and see if it's helpful for you. But my presentation was actually about to end. My last slide was going to be just my information, which I can put it up. Just so everybody has access to that again. Okay, is everybody, Beth, can you see the last slide?
Yes, ma'am.
Okay, so that was a quick little rundown of the system of care work that I do, how I work. Oh, you know what? There's one more slide that we skipped. Okay. No. Okay, there was a slide, it's not here anymore. There was a slide to discuss complex needs. So I'll do a quick little explanation of what we refer to as complex needs at the regional center. So for complex needs, it'd be any case where the individual can have a dual diagnosis, so a developmental disability and a mental health need. We also consider cases that are going through crisis or have severe behavior as having complex needs. And then the third option is the one that has the multi-agency involvement. So if the individual is a foster child or is on probation, or they have some type of legal involvement, for example, if you know they've been in jail or there's a court case pending and they might go to jail, so our legal team has to get involved. Any of those three options will also be considered having complex needs. And those are the cases that I can be involved in to help support the families or the consumer. We can open it up for any questions if anybody has a question.
Great. One of the questions, what age is the training appropriate for? Do you happen to know that?
The training for crisis intervention?
Yes.
They're usually not based on age, because even our residential facilities that are for children, they're still able to do crisis intervention in those homes.
So, yeah, and the fact it's free, you always register, and then if you don't like it, then you don't like it.
Yeah, you can log out. If it's not something that you're interested in, you can just log out.
Exactly. Okay, what other questions do you have? I know I was surprised that Inland had the collaborative. I love the collaborative. I was surprised with some of the other resources. I'm gonna send it over to our audience and say, was there anything that surprised you by what Rosie presented, or questions? Another question was, will the respite for severe behavior start up again?
So the behavior for, sorry, the respite for severe behaviors, the issue with that right now is that we only have one vendor available. So it is available, it's there. The issue is that we don't have enough agencies to provide it. And so you have to request it and submit the request, and then your service coordinator will check to see if the agency is available in your area, and if they are, if they have any available staff.
Rosie, I don't know. One of the things that we hear a lot is that whether it's respite or behavioral respite or some of the other stuff, that there aren't enough vendors, and parents are submitting their requests and they're on the list, but the list, nobody knows when they're going to get the services. Is anybody like keeping track of all these unmet needs, or because that does trigger severe behaviors and a lot of stress for the families?
It does, yeah. So behavior respite, we refer to it as behavior respite, but it's technically vendored as an individual and family training. And so we only have one agency that is qualified to provide behavior respite. So that's where the limitation is. But you can still request like regular routine respite. And what we try to do is find an agency that's willing to work with the child. And we do tell them if there's any behaviors involved. And if there's ever a need where they need to have more than one respite worker, that's also something that could be communicated to the service coordinator. It gets presented to the program manager, and sometimes it even gets presented to the behavioral health team. And if they agree that that child does need more than one respite worker, it's a service that can be authorized to help meet that need, because we are aware that we do not have enough behavior respite, individual family training services. And just to put it out there, we are aware also that like the respite agencies are not able to hire staff fast enough to meet the needs out there as well.
That I don't know if you can hear, or if I'm frozen. We'll see if I come back. There we go, I'm back. Okay, another question. Is there some sort of transitional placement for adults in crisis to kind of cool down that maybe does not involve the police or hospital?
A transitional placement, so where I just want to make sure this is what they're referring to. Transitional as in temporary, where they would just go for a couple of days?
Yeah, like I don't know if it's that long, maybe it's 24 hours, or it's a cool down place to get them out of. I'm more used to the family homes that they would need to give families a kind of a break. They need to de-escalate, and then but families don't want to call the police or take them to the emergency room.
For adults, it's actually a little easier to request placements when they're adults. The only issue is that if they are an adult and you request placement for them, and so IRC will ask them, do you want to go into this placement, which would be a residential facility, by the way. If they say no and they're not conserved, we can't force them to go into that placement once they're 18, because as an adult they have a right to decide if they're placed somewhere or not. So if they're conserved, then the parent or the conservative still has the decision of where that individual will go. And my suggestion in those cases would be to request that they be placed in a residential facility for them to become stable. And then once the behaviors decrease or they're on an appropriate medication and the family feels like, they can come back into the home, then you can remove them out of placement at that point. But remember, if this is only if they're conserved. If they're not conserved and they verbally say, no, I don't want to go there, we can't force them to go.
Rosie, do you find we also hear that there's a waiting list for residential placements a lot of times? So when the family's in crisis, trying to find a home that will take them, and it's a process and everything. And meantime, you know, time's elapsing and things are escalating. I know, Tina, that Easter Seals is working on, it's not quite the same thing, but a severe behavior center, similar to what they have in Maryland at Kennedy Creek or the Marcus Center in Georgia. And unfortunately, there's nothing like it, you know, west of the Mississippi. So they're trying to find places, but yeah, I agree. I mean, would it be possible? Well, I guess just with the funding, it wouldn't, to have that, like, you know, they had COVID homes and people were able to come in and out, but just something that you could say, my son needs a place, but I need to be able to pick up the phone and call them so that they will take them right away. A model like that. Does that exist?
No, we do not, because IRC doesn't offer like emergency placement. So when a placement is requested, the request has to be submitted, then they'll check to see which home is available, and then they'll coordinate the move-in date. So it's never like, we need somebody tomorrow, can they take them? I mean, you might get lucky, you might submit the request, it's an emergency, they'll look that day and they might find a home that says, yeah, bring them tonight, and they'll take them. But that's not always the case, because our homes are not considered to be like emergency placements. They're just placements when they're needed. You can, I don't know if this is what they were referring to, but for temporary placements when an individual is in crisis, I would still suggest, you know, the hospitals, just because they might be able to find the appropriate medication that they need, and then they can go back home. When an individual is in severe crisis, where, you know, it's an everyday crisis, every day it's aggression, every day it's hurting themselves or another individual, we have to start thinking about the higher level homes, like the community crisis homes or the enhanced behavior support homes. And those are the ones that have wait lists. Those are the ones that we have to start the process, you know, sooner rather than later, because of the wait list they have.
I know one of the other possible models that I hope Inland's considering now is the START model. And I know that I believe there's 5 regional centers in the state that don't have START model yet. They're supposed to be rolling into a year. I keep hoping Inland's this is gonna be our year. And the START model is a mobile crisis team. Which may also be another tool, not the only tool, but another tool that might help families that have individuals in crisis. So I don't know if you've gotten the inside story, if this is going to be our year, but we're pulling for it.
Yeah, it's been discussed. It was actually discussed, I want to say, well, it's already been 2 years since COVID, so maybe 4 years ago. When I worked in resource development, it was discussed, and we went over the process and everything that was involved. That's kind of what started our crisis services. So that's why we started our crisis intervention as well, because it's a similar model where you can call the crisis services, and they will go into the home during the crisis. But of course, it also has to be nearby. So crisis services right now is limited for us because we don't have enough vendors either, but it's a similar model where if there's individuals in crisis, you call them on the phone, they try to give you resources on how to support them. You'll tell them what's happening. If they feel like it's getting to the point where someone's going to get hurt, they will suggest that you call 911 just to protect yourself, to protect them.
Yeah, and I will say, just from an advocacy point of view, we've been talking to, I understand the 911 to protect yourself and others, but on the other side of it, you know, first responders, law enforcement will say, if you call us to control the situation, we're going to come in and control the situation. And that may mean putting your loved one in jail or handcuffs or anything else. So it's a hard one.
It's a hard decision, yes.
Yeah. Tina also, and I'm going to call Tina. So I didn't know you did from the Kennedy Institute. So woo-hoo, shout out for that. Tina asks, since it's so hard to hire people, is it reasonable to expect Regional Center would work with colleges like UCR, UC San Bernardino, and use college students? Like for the vendors and I guess that's what you're talking about, for the vendors, for the staff shortages. And I don't know if the vendors have explored, are they really looking at those colleges for staffing? Do you know?
Yes, well, each vendor type has specific qualifications that they have to follow. So if the qualifications say that the individual has to have a bachelor's degree, you know, based on the regulations that we follow, Title 17, if Title 17 says this individual has to have a bachelor's degree, then it has to be an individual with a bachelor's degree. There's no way around that part of it. But if we're referring to like behavior respite doesn't require the direct staff to have a bachelor's degree, but under behavior respite, they do have to be trained under a BCBA. So they would still have to have a BCBA on board as part of their staff. So really, it depends on the type of vendor. But yes, our respite agencies are always constantly hiring. They do have hiring fairs where they're looking for respite workers, but they're all competing with each other. So that limits it as well.
It does. We have another question. And so correct me if I'm wrong, but I think the question is, how do we properly notify that our child received another diagnosis? And I'm guessing that you mean the caseworker. How would you notify the caseworker that your child's received another diagnosis? Like, what would that process look like?
Would this be like a mental health diagnosis or just another diagnosis?
So let's pretend let's pretend it's mental health.
Yeah, you just have to notify your service coordinator. You can send an email if you have any supporting documents. Sometimes like schools do evaluations, and during the evaluation another diagnosis comes up. You can share that information with your service coordinator, and then she'll update her IPP and she puts it in there, or they say they put it in the IPP.
Yeah. And I just want to reiterate that the best way right now to contact the caseworkers is email, because a lot of them are not back to the office, and aren't they alternating? So if you're expecting this phone call back, it's much, much easier to put it in writing, just an email. That's the fastest way.
And I always encourage emails just because it's tracking your documentation. So in the future, you can always say, well, I have the email that shows that I did request the service, or I did reach out on so-and-so date, and nobody responded back to me. So this is the best way to document your efforts that you have done, is by sending an email. And you could always CC the program manager if you feel like you're not getting a response.
I believe, and I haven't looked at the website, but if you don't know who your program manager is, I believe on the website now there's a place you can look it up, and you type in your caseworker's name and then it'll show you who the program manager is. Is that correct?
That's correct. We have that available, yes.
I'm thinking already. What do we need? Oh, you guys are being easy tonight. Come on. Rosie can handle the hard questions. She's seen it before. I'm curious if just put it in the chat if you have any questions. I'm curious, Rosie, you talked a little bit about that collaboration, and I love that collaboration. I didn't see law enforcement in there. Is that because that's a different department, or how does that work?
So the collaborations that the system of care coordinator position works with are those that are required by the state law. So California required all of these agencies to create MOUs, memorandum of understandings, of what each agency would provide for each of our individuals. The police officers, law enforcement, they haven't made it to any of these interagency collaborations yet. The best we have tried as regional centers is to provide education to law enforcement about our population. We've had meetings to discuss cases, specifically cases that come up a lot. I'm sure, Beth, you're aware sometimes, the police gets called and they know someone so well because they're always getting called that they might not even pay attention to what's going on. They'll reach back out to us for us to intervene or provide the services that they are requesting or needing, or just to help the family. So they are not a part of the system of care partnership yet, but the goal is to involve all of the agencies that work with our population or eventually intertwine with our population, and law enforcement is one of them, especially for those individuals who go through crisis and get the police called on them. Eventually, yes, we will love to work with the law enforcement in all of our areas. That would be one of the goals.
I'm going to ask a similar question about the hospitals. And one of our families wrote, a year ago, the police were called for my son, transferred him to the hospital. Once there, the ER staff has said a 5150 is never appropriate with somebody with autism. So back to need for resources. And we're hearing this more from hospitals because law enforcement know that 5150 that they'll often just let them go home in an hour or 3 hours. They don't want to take them to jail, so they take them to the hospitals, and now the hospitals are starting to say, well, what are we supposed to do with them? So have you had experience with the hospitals or drawing them into this crisis care conversation?
It's usually the hospitals who reach out to us. They're very aware now that we are doing this whole collaborative work. So when that situation arises and there's an individual in the hospital, it mainly comes up when the individual is in the hospital and they have nowhere to go. So if they're ready to be released and the family is not able to take them back, or if they're in foster care and they don't have anywhere to place them, that's usually when the hospital is reaching out to us to find out what the next step will be, or what the plan will be. They work with us to create a plan in case we're not able to find a placement fast enough. They do collaborate with us and try to support us as best as we can. And we try to support them as well too, because we understand that our individuals, shouldn't be in the hospital waiting for placement because we don't have enough resources for them at that time.
You mentioned and the collaborative with the foster families. I cannot remember the initials, but does that apply to early start as well, or is that for age 3 and over for the individuals in foster care?
It applies, yeah.
Everybody?
As long as if they have a CFS case open, Children and Family Services case open, then yes, we collaborate with them. Yeah.
Okay, perfect. Another question, what advice would you give to a family that has never been able to use respite services because of the severe behavior? It's been 6 years and many pleas to the service coordinator.
I would suggest an IDT meeting. That way you can have the service coordinator and the program manager involved. You can discuss what's been going on that you requested the services. It's been 6 years, you said? It's been 6 years and you haven't been able to receive the services, and then hopefully they can come up with a plan on how to provide you that service. Definitely they should be reaching out to the behavioral health team to see what other options might be available, but the best way to do would be to request that IDT meeting.
And remind me what that stands for?
Interdisciplinary team meeting. Okay.
So you hear that? Interdisciplinary team meeting. That's what you want to request.
Yeah. And if they're not, if it's easier, you can also just request to have an IPP meeting and just make sure that that information is in your IPP and that it's the service that they're working on.
No, I like, we've had some families with the interdisciplinary team meetings, and those seem to be much more just like anything, right? Think of your IEP or anything else. The more people that are looking at it, the more ideas that come up with. That's a great advice. Thank you, Rosie, for sharing that.
You're welcome. And the IDT meetings, sorry. They're also great when you have multiple agencies involved. So like when you have an ABA provider, maybe OT or PT, you can invite all of those representatives to the IDT meetings.
Another question, I'm going to make this general. So let's say you have a school-aged client and is having a lot of behaviors in school, even though the school's offering, you know, one-on-one help. What could regional center do in cases like that? There's some ideas.
When it comes to the regional center services, we cannot overlap with educational services. So when the child is in school, IRC cannot implement any services while they are in school. But if they're not getting the one-to-one, that's definitely something to request during the IEP. The other service that can be provided is through the insurance, and it's like ABA. If when they need extra amount of time, that's another service that can be requested. But through the regional centers, we just can't overlap with educational services.
That's a good point. And I think one of the mistakes that I make sometimes is sometimes I forget about the medical services that are available. And medical has responsibility for behavioral health and behaviors, especially when they're that age. Besides, you know, looking for an FBA, a functional behavior analysis at school, it is legal for medical insurance to pay for ABA. It's not for educational benefits at the school, but they provide like bubehavior impedes adaptive living skills. So there's a possibility of getting for by an ABA company in the schools.
I also I can also suggest you, depending on what the behaviors are and the need, you can also get services through like the Department of Behavioral Health, and they have wraparound teams that also go to the school. So if that's a need, my suggestion would be to reach out to the Department of Behavioral Health and explain to them what's happening, what's occurring at the school. They will want to see the IEP just to check to see what services are currently implemented. But I know for foster care cases, they have the wraparound teams, so they should be able to provide something similar to the children who are not in foster care, but also have a mental health need. And then it comes with an assessment, so they'll be able to check to see if there even is a need for that and try to support it in that way.
Another great resource. Yeah, I mean, and I know I'm preaching to the choir, but it's tough as families to pull all this together and try to figure out which service system to go through and which service system offers which resource and advocate in that system, all while trying to manage maybe the complex needs at home. So thank you all for what you guys do. All right, I'm gonna call it one more minute. You guys have any other questions? I'm checking the chat, checking the Q&A. Is there anything else, Rosie, you want to share?
My information was shared earlier. So if anybody wanted to reach out, I would always encourage you to reach out to your service coordinator. But if you're not getting a response in a timely manner, you know, feel free to reach out to me and then I'll make that connection. Or if you have any questions about what we discussed today, you feel free to email me. That's the best way to contact me as well.
And I think the keywords were interdisciplinary interdisciplinary
team meeting.
I put an extra T in there. So yeah, with that knowledge and with you know, Rosie and the other resources, don't be afraid to ask for what you want. Even if you've asked for it in the past, it's okay. There's new resources out there and a new person to help guide you. So hopefully that will help. All right, thank you everybody for being part of tonight. Like I said, we'll be sending out the presentation and the recording tomorrow. A huge thank you to Gilbert, who was our interpreter, and of course Rosie, who was our fabulous presenter tonight. So thank you all for being here. We hope you stay safe, and thanks for being part of our community. Take care, everybody.
Thank you.